Hi, I'm Ezra and welcome back to my channel, and if you're new here, hello, my name is Ez and I am a trans guy living in Brighton and I make videos about it. So I got top surgery on the 18th of September, which is nearly 8 months ago now. So I thought I could do a huge breakdown into how I got top surgery and the whole process of it, and then answer some questions at the end. So I got my top surgery with Miles Berry, and that is at Cosmetic Surgery Partners in London. So initially I went to his website and registered like an inquiry. Like basically I just sent an email saying that I want top surgery. So there was a couple criteria that I did need to meet to get top surgery from Miles Berry. He required me to be 6 months on testosterone if I had started yet, which I had, so I had to wait 6 months. And then also I did need a gender dysphoria diagnosis. So I went through Dr. Poppy Luke to get that diagnosis. I did go privately because otherwise it would have taken a very long time, and going privately does speed things up. So my gender dysphoria assessment was online. It was through video call and it did cost me £500 for the assessment. I talked to this lady and did a bit of a deep dive into my mental health history and what it was like growing up and my childhood and all that kind of stuff. It was very deep. It was like, I think it took about maybe 2 hours of just like talking to me and like getting a grasp on basically if she thinks I'm trans. I also had to choose someone that has known me over 2 years to basically validate my existence and be like, yeah, he's trans. So I asked my friend if he would be happy to do that, and he was. So they called him up and basically asked him a bunch of questions about me and talked to him for like 45 minutes or something like that. I can't really remember because it was quite a while ago. So I got diagnosed with gender dysphoria, and then it meant that my top surgery process could continue. So it started off with me going to London to see Miles Berry for a consultation, which cost me £250. It inevitably was me telling him what I want from the surgery and what I want my chest to look like. He also needed to see my chest as well, so he took photos so he could see what he can do with it. So there are multiple different types of top surgery that you can get. There is peri, which means that you can take off your nipple and then liposuction out the fat in your chest, and then basically put the nipples back on, and then it means that there isn't two scars. So if you have a smaller chest, then that could be something that you could do. And they also do keyhole as well, which is also a very minimally invasive technique, but it only tends to work with people that do have very small chests. So that wasn't possible for me. So the plan with Miles Berry was to get double incision with nipple grafts, which essentially means that they cut here, remove the nipple, and then reattach it. So you have two scars here and then slight scarring around the nipples, but to be honest, mine have healed now. A few months later, I got a confirmation on my top surgery date, which was initially the 22nd of September, I'm pretty sure. And then they had a cancellation. So basically, I just said to them, like, if there's any cancellations, please take me in. And they did. They had a cancellation on the 18th. So then I took that one and got my top surgery on the 18th of September instead, which was a couple days before my 6 months on T, but I told Miles Berry that and he said that it was okay. At the end of the day, a couple of days more on testosterone is not going to make a difference. So now we get to the day of surgery. So I live in Brighton, so I had to travel in on the train and on the tube to get to Cosmetic Surgery Partners. I had to get up super early because my appointment was a morning appointment. So I think I arrived there around 10 a.m-ish. It was quite early. I do remember getting up very early, but I was so excited. So I don't think I really minded, to be honest. When I arrived, I had to fill in a form about what food I wanted for later, which was genuinely so hard to look at the food choices because before surgery you have to not eat for like an extended amount of time. So I was hungry and I was just so excited to eat. So I was really like looking at the foods thinking like, I can't wait to eat this later. Specifically this ice cream that I just love. I don't know if you've seen my top surgery vlog, but I show you it in there and I do rave about it. And honestly, I still think that is like one of the best ice creams that I've had. I don't know what it is about Miles Berry's ice cream, but if you get top surgery with Miles Berry, ask for the ice cream. My boyfriend Isaac came with me and he was there the whole time, apart from in surgery, obviously. And then I also got visited by the anaesthetist, which was really helpful because I was really nervous about going under general. Like, I have never ever had a surgery prior to this, and I've never been in hospital or anything, and I've certainly never been under general. So I was very nervous about what it was gonna feel like. I was really nervous that I would wake up or something. But that didn't happen, so didn't need to worry about that. But yeah, I spoke to him about it and he said it's like flying a plane and that he's not going to leave and he's going to be there the whole time, tweaking things and making sure that I stay gone asleep. And when the anaesthetist left, I was then greeted a little bit later by a nurse that gave me some things to change into, and that was essentially a gown and this very weirdly textured underwear that was kind of a bit like a plastic bag. My top surgery took 4 hours. I do have psoriasis on my chest, so I think that's why it took a bit longer than like other people that I know that have had top surgery with him. Some people that I know, it's only taken like an hour and a half, 2 hours, but I don't know if it just took longer because of that. But yeah, I had psoriasis in the middle of my chest, which strangely enough, since top surgery, doesn't really flare up anymore. I've had one flare up in the last nearly 8 months, so don't know how that happened. I guess it just kind of disappeared. I don't know if the lack of sensation on my chest has caused it to not flare up as much, but who knows, but I'm here for it. I remember when I woke up I was in the bed being wheeled back to the room and I saw a nurse that I hadn't seen before, and I remember being like, I don't know you, and also I need the toilet. And that was the first thing that I said. And I recall that very well. And then I went into the room and I remember saying like, I need the bathroom, I need the bathroom. And usually you get like maneuvered from the bed into the bed that you're then staying in. But because I needed the toilet, I just got up. So yeah. I didn't get maneuvered in, I was just moving around straight away, so that was that. That was honestly one of the bits that I was quite nervous about, was the being carried from the bed into the other bed, but I completely skipped that part by needing the bathroom. I really liked the nurses that came and looked after me. They were really kind, and at one point I dropped my phone on the floor and it was like attached to my charger and I dropped it on the floor, and obviously because I just had top surgery I couldn't lean over and grab it, and the cooler thing wasn't working, like my cooler button, so I had to like phone the reception and then they sent someone in to help me and he was so nice. So my camera actually got too hot and told me to turn it off, so here I am a couple days later. So I'm pretty sure I just got to the point in the story where I've just had top surgery. So my best friend Louis, who can drive, him and my boyfriend Isaac came to pick me up from London Welbeck Hospital, and it took maybe about an hour and a half to get home. I had some pillows behind me when I was in the car, and I had lots of snacks with me that I didn't manage to eat yet, and I got to eat them on the drive. At this point I was still wearing compression socks so I didn't get deep vein thrombosis, and I do remember being particularly nervous about the idea of getting DVT, but I didn't. I was absolutely fine. But yeah, I wore them for maybe about a week and it did make my legs feel quite itchy, so I don't know if I actually made it the whole week, but yeah, I didn't get DVT. I was just worried about it. The first week of the recovery process was me being in bed a lot. It was a lot of me just kind of relaxing, and also I spent a lot of time watching TV, just sat on the sofa. And my friends did come over a few times to cook me meals when Isaac was at work, because I couldn't lift anything and I couldn't like do anything myself. I couldn't put t-shirts on by myself or anything like that. So I did have to rely on people to help me, and they did. So I'm really, really grateful for that. There was this one occasion where my friend Kira came over and she made me soup, and it was so tasty. Like, she made it like from scratch and it was just, oh, it was yummy. Initially I thought I was gonna find it quite difficult to accept support, because I do struggle a bit with feeling like a burden, and I never want to feel like people have to help me kind of thing. But because of top surgery, I literally had no choice, and I just had to get comfortable with it. And luckily my friends are really lovely and they were so happy to help me. I definitely recommend having a support system when you come out of top surgery, because you do need people to rely on and to do things for you, because you won't be able to do the things that you could do before. Definitely not straight away anyway. And then a week after my top surgery was my reveal. So the bandages that I'd had covering myself were going to be removed. And this was so nerve-wracking because I had no idea what it looked like under there. And I was nervous that I'd somehow messed it up, that I'd done something to my top surgery and moved too much. But luckily, I was absolutely fine. And if you do want to watch my top surgery reveal, I do have a video on here of the whole thing. So you can see my results for the first time. And I honestly felt very, very emotional because I was recording the whole thing, which actually I think was making me extra emotional because I could see my top surgery before I'd maybe be able to see it if I wasn't filming, because I could just see myself on my camera and I was just like, oh my goodness, this is amazing. And honestly, it did hurt quite a lot getting the bandages taken off, and it was quite spicy. It felt very uncomfortable and very tender. That was the main thing. I just felt very, very vulnerable. So as for the post-op binder, you have to wear it for 6 weeks. I think I made it nearly to 6 weeks. I think maybe I did like 5 weeks, because honestly it was so painful and it was digging into my ribs a lot because it was a very, very tight post-op binder. It's very different to like regular binding because usually you've not got a wound under there. So it was very, very, very tight because obviously it's trying to keep it all together and so it heals properly. And I ended up putting fluffy socks underneath to like help it not dig into my ribs as much, and that really helped, honestly. I remember people doing like drawings of me at the time, and people kept drawing me with my fluffy socks in my post-op binder, which was so adorable to see and made me feel really, really happy. So yeah, post-op binder absolutely sucks. It's a horrible part of the process, and I wore that for like 5 weeks. Definitely cut it a week short. It just helps with swelling really, and helps you get the best results possible. One of the things that I did, I guess, have troubles with the healing process was the right side of my chest for a while was a lot puffier than the left side. And I went to see Marsberry about it, and since then, it's honestly gone. I honestly think working out at the gym has actually got rid of it. So I don't actually have the build-up of swelling on my right side anymore. It seems to have really gone down now. So I did ask you on Instagram for any questions that you do have about my top surgery process, so I thought that I would answer them now for you. So this question says, who did you bring with you and how do you process and prepare for it mentally and emotionally? So I took my boyfriend Isaac with me. He was there the whole time, and honestly a lot of it was just having that support system afterwards, because you are in a bit of pain for like the first few days. Like I think I was on meds for maybe like 3 or 4 days, and then I didn't really need them anymore. I was trying to not use them. And I think I maybe used them once more, like a week later when I was in a bit of pain. But yeah, a lot of the mental aspect of it that I was struggling with prior was the anesthesia, because I was nervous about going under, but obviously got reassured by the anaesthetist. So any issues that you have or any questions that you have for your top surgeon, honestly just ask them, because they will reassure you and let you know anything that you need to know about it. So on to the next question. How did you find your surgeon? Honestly, through word of mouth. A lot of my friends have got top surgery through Marsberry, and I just went through the same guy. I want to point out though that Marsberry maybe isn't the best when it comes to plus size people that want top surgery, because for whatever reason he has a skill issue there and refuses to give top surgery to people that are bigger. And I didn't experience that firsthand myself. However, one of my friends recently went for a consultation and was told to lose weight. Top surgeons should know how to do top surgery on larger people. Completely a skill issue on Miles Berry's part. But yeah, do research into the kind of results that you want for your top surgery, and by no means feel like you have to go with Miles Berry simply because I did. Definitely find what's best for you. So someone asked, how did top surgery affect you with the gym? Honestly, I didn't start going to the gym until about December, and then when I did start going initially, I was being very careful with the movements that I was doing, and I kept the weights pretty light because obviously I was still healing and I didn't want to do anything like stretch my scars or anything like that. And at the beginning of working out, I was still wearing tape on my scars so that they don't stretch, but then I stopped doing that because for some reason I got a reaction to the tape and it started leaving rashes on my scars. So yeah, stop doing that. But top surgery didn't really affect my performance in the gym. I didn't go to the gym prior to top surgery. So I just got to build it up, and now I can do everything pretty normally and put my arms all the way up if I really wanted to. The next question says, did you get nausea/throw up after the surgery? If so, how bad was it? So when I woke up, I really needed the toilet and I did feel a bit sick. I thought I was going to throw up, but I didn't. And I do know people that have had their surgeries recently that did feel very, very nauseous. And my friend Noah, he got his like not very long ago, like a few months ago, and he did feel very, very sick and he was like throwing up a lot. So it's so normal to feel nauseous when you're coming off general. So try not to be worried about it, but I didn't throw up myself. On a scale of 1 to 10, how much did recovery hurt? I'd like top surgery one day, but it scares the hell out of me because of pain, lol. Honestly, really not very painful. Like, when I woke up, I wasn't like in immediate pain, and I was on meds for like 4 days. And when I was actually in the hospital, because I stayed for one night, they were constantly coming in and checking on me and giving me more meds. So I didn't really feel much pain. I just felt a little bit achy and quite tired, and I just felt like I really needed to sleep. Honestly, I just did a lot of sleeping when I was recovering, but it really wasn't very painful. I've had more painful things, like genuinely, like trapping my finger in a car door. Like that was more painful than me getting top surgery, which you wouldn't think so, but it was. I think also because nothing positive comes out of trapping your finger in a door, but something definitely positive comes out of getting top surgery. So I was just really happy. So I don't think I was particularly complaining about the pain. Isaac may tell you differently. I might have been more whiny than I remember, but I don't remember being in too much pain. Did you need help doing basic stuff after top surgery? Yes, I did. I needed help for everything. I couldn't put tops on by myself. I remember I did one video where I was like, get ready with me, but Isaac puts my clothes on for me because, yeah, I couldn't move my arms very much. So I did have to rely on others to help me. And luckily, my boyfriend was here the whole time and he helped me so much with it. Someone said, how can you fade scars? Bio oil, I will show you. So this lovely product here is called Bio Oil. I use this every single day, like 2 times a day, once in the morning, once at night, and it reduces scarring and eventually the scars will go white. And I love it, I think it's great. And honestly, if you're just like watching TV or something, if you just like put it on your scars and just massage them, it can really help. I find it easier if I watch something while I'm doing my scar care because then it makes me think less about it, and it just feels like a less boring activity, because that's the thing with scar care. It's like, you know you should do it, but it's like kind of boring. But if you put on your favorite TV show and do your scar care, then there we go. You'll get some really lovely faded scars. Someone said, were you afraid for the risk of losing your nipples? I don't think I was particularly nervous about losing my nipples because I didn't think I would, because I took all the precautionary measures so that that wouldn't happen. It's really important that if you do use nicotine that you stop 6 weeks before top surgery and 4 weeks after. It can really affect your healing process and you can then lose your nipples. So if you're consuming nicotine, you've got to stop 6 weeks before, 4 weeks after, 10 weeks in total. I think that answers all the questions that people have left about top surgery. Of course, if you do have any questions yourself that you want to ask me, please do leave them below. I would love to answer them for you. Thank you so much for watching this video. I hope you have a wonderful rest of your day. Bye.